Morning, everyone, and welcome to today's webinar. On behalf of all of us at Karl Marx Advisors, we know that today's webinar with Michael Dowling will be both informative and very meaningful. My name is Mark Claster. I'm a partner at Karl Marx Advisors, and I am also a former chair of the board of Northwell Health. Before I introduce Michael, just one quick note. You'll notice on the bottom of your screens, there's a Q&A chat button. We will take questions at the end of the webinar, but during the webinar, as questions come to your mind, please type them in and we will get to as many as we can when Michael is done speaking. So with that, it's my pleasure to introduce Michael Dowling. Michael Dowling has led Northwell Health as president and CEO for 22 years, driving the remarkable expansion of Northwell's clinical, research, and academic enterprise, which now generates an annual revenue of $18 billion. Under his leadership, Northwell has grown into New York State's largest healthcare provider and private employer, with a workforce of over 88,000, serving more than 2 million people annually. Northwell's vast network includes 21 hospitals, soon to be 28 with the acquisition of Nuvance Health, more than 900 outpatient facilities, and over 50 urgent care centers, along with home care, rehabilitation, and end-of-life services. Michael is widely recognized as one of the most respected voices in healthcare. He earned the #1 spot on Modern Healthcare Magazine's 2020 list of the 100 most influential healthcare leadership. Michael has been a steadfast advocate for industry reforms, pushing for a more patient-centered, quality-driven, and safe healthcare system. His commitment to addressing societal issues, such as gun violence and immigration, has earned him widespread respect and recognition from peers and the media alike. Before joining Northwell in 1995, Michael brought with him a wealth of diverse experience. He notably served in New York State government for 12 years, holding prominent roles such as Director of Health, Education, and Human Services, Commissioner of Social Services, and Deputy Secretary and Chief Advisor to former Governor Mario Cuomo. He is also a professor of social policy and assistant dean at Fordham University's Graduate School of Social Services. And on a personal note, I was privileged to work with Michael while I was chair of the board for 5 years, and he's one of the most inspiring leaders in America today. So without further ado, let me welcome Michael Dowling. Michael?
Thank you, Mark. Thank you for those comments, and also special thanks to you for your leadership of the health system over so many years and your current involvement with it. Welcome, everybody. I'm delighted to have the opportunity to speak to you for a few moments. Let me start by just also expanding just a little bit on what Mark said about Northwell. We're also a huge academic teaching place. We're actually the 4th largest in the United States, with a very, very unique medical school, nursing school, etc. Huge educational portfolio of services. And we have a huge and very, very important research center called the Feinstein Institute for Medical Research, which is at the cutting edge of new fields of medicine these days. So we're very, very, very comprehensive. And as Mark just mentioned, continuously growing. So what I thought I would do this morning is give an overview of the larger issues that we have to deal with when you're involved in a health system like this, but also some of the larger issues that the United States has to think about going forward. We can go into detail and during Q&A on any one of them, but I thought giving a broad overview of some of the issues I think would be important at this point. And I like to start with something that I think is very, very important and that I do all the time. And I specifically do it when I meet with all new employees, because we hire at Northwell about 250 employees a week, and I spend a couple of hours with them every single Monday morning and have been doing so for 22 years. But one of the things that I try to impress upon them, as well as outside audiences, is to be very understanding of the dramatic successes that have occurred in healthcare over the decades, because we're very, very, very fortunate. And the discoveries and the science and the resulting treatments and protocols that are now in existence as a result of all of the advancements over the past 50 years is absolutely extraordinary. And I know there are many people listening that can remember back, to the 1950s and 60s and 70s and even 80s, and to contemplate what you could do back then, which was so much less than it is today. And so what we can do today was almost unimaginable back then. So it's very, very important to be very, very cognizant of the success that we've had in healthcare overall. We're in so much of a better place today, and I would claim so much of a better place than most places around the world. So there's an awful lot to be proud of, and it's an important thing to obviously ponder as we talk about healthcare, and especially if you're in it, to be proud of the accomplishments. And I could go and enumerate some of those unbelievable advances, but time will not permit here unless we have questions later. So let me talk a little bit about some of the larger macro issues that, if you're in this business now, that you're constantly focused on. And one is, I have about 7 or 8 of them. One is the constant consolidation in the marketplace, and this is happening all over the country. It doesn't matter where you are. Health systems are getting bigger, just as we are, and the good ones are constantly attempting to create a very large integrated system, which we are, which means, and Mark alluded to this at the beginning, is that we have all components of healthcare. Everything from primary care, from birth to end of life. It is important for people to recognize that the very good, innovative health systems are not all about hospitals anymore. The outside world, advocates and others, will obviously talk about the fact that we are, and define us as being all about hospitals, but only about 47% of Northwell's business today is hospital-based business. This is a very important thing to keep in mind, because most care is moving out into the community. Mark referenced that we have 900 outpatient locations, and that number is growing. But having an integrated system where all of the components are coordinated, because care is a transition, if somebody has an illness, it's a transition from primary care right through end of life, and we have all of those pieces. So the good organizations are constantly trying to consolidate, get bigger, but create that integrated systemness that is so important with all the components. So the competition is in the region, in every region, is constantly growing and accelerating. And you have lots of new entrants into the marketplace. Private equity, technology companies, Amazon, Google, CVS. And I welcome all of this, because I think anytime there is something new that occurs or somebody brings something new to the table, we all learn. But what's important to remember about many of those new entrants is that they'll typically try to take on the easier part of the business. Very few of them want to take on hospitals. Very few of them want to deal with the serious chronic illness issues that we see in hospitals all the time. So many of these new entrants, other than the traditional health systems that are growing, take on services on the fringe. Nothing wrong with it, but it's just something to fully recognize, that they try to take on the easy stuff and leave the non-easy stuff to others. Another number 3 broad issue that we are all facing with these days is demographics, the aging of the population. We are living about 35 to 40 years longer today than people lived about 70 years ago. The number of people in the United States over age 65 by the year 2035 will be larger than the number of people in the United States under the age of 18. And this brings with it a whole series of complicated issues, social, political, real estate-wise, etc., but also healthcare-wise. So the phenomenal growth of chronic illness associated with aging is forcing all of us, as we are at Northwell doing and very involved in, is to create what we call age-friendly health systems. If you go into a hospital today, in most major health systems, most of the people in the hospital are older with multiple chronic illnesses. They don't just suffer from one thing, they suffer from multiplicity of things. So the old traditional way of having siloed departments, where cardiac is separate, for example, from orthopedics, it's separate from respiratory, it's separate from medicine. And the way we work, that traditional way we work is not as relevant anymore because it requires a complete different interdisciplinary approach to the treatment of care. If you're in 75 and 80 and you have cancer, you not only have cancer, you have multiple other things as well. So the question is how can you, in a large health systems, to deal with the multiplicity of issues rather than just the silo single issues that people may initially just present with. So aging is one issue. We're having actually a large national conference on aging on December 3rd here in New York, where we are bringing people from all over the United States. The second issue inside the demographic column is labor costs, unionization, the growth of unionization, and not in itself a bad thing, but the costs associated with it can be particularly difficult, and that is true in many places, especially in New York and in the West Coast. And I will come back later to talk about the reimbursement issue. But when your costs are going up 4, 5, 6, 7%, in many ways pushed by government, who at the same time doesn't pay you enough to meet the cost of covering the expense, becomes an issue. But labor and unionization is an issue that everybody is concerned with. We've had numerous potential strikes here at Northwell over the last couple of months. None of them actually happened because we were able to resolve the situation, but it takes up a lot of time. The other issue is the workforce in general, more diverse, younger, different expectations, less tolerance for inconvenience, more tech savvy, more interested in instant gratification, a little bit different than those of us in the baby boom generation, where we grew up at a different time, influenced by different circumstances. And most leaders in healthcare organizations today are baby boomers. So we have to become very adaptable to the new needs and the changing needs of a younger, more mobile, people are interested in remote work, for example, as many of you are aware, and also more technologically savvy. This requires rethinking all of our HR policies, our training policies, our onboarding policies, motivational strategies, how you get people to belong and get committed to the organization rather than just work for the organization. That is a constant issue that we spend an awful lot of time dealing with here, and I know other systems around the country are doing so the same. The fourth issue, which is connected to one I just mentioned, is the growing role of technology and AI. AI, as you all know, has been around for an awful long time, since the 1940s, but it has escalated in its power and its strength and its abilities over the last number of years. So there is hardly anything these days that we're involved in that doesn't in one way or another be connected with the use of technology. We have created a Center for AI excellence inside Northwell. We've actually created some AI companies. We're using AI for early prediction of diagnosis, for efficiency with regard to doing some manual issues that have in the past been done by human beings. In many ways, we will be going through an experiment for the next many years to figure out the appropriateness of AI and its appropriateness for what. It has wonderful, wonderful benefits, and we've got to optimize it. But we have to be very, very careful, especially in the healthcare field, and I would suggest in other fields as well, that we don't divorce technology from the human factor, especially in healthcare. Healthcare is a combination of the human element, the face-to-face, the power of relationships, the power of contact, the power of being together, the importance of socialization, with the optimization of the use of technology. This, as I just mentioned, is going to be an experiment for at least a decade going forward as to how we manage this new evolution. But hardly anything that we do will not be in one way or another affected by technology. Another issue, global issue that needs, obviously a societal response, and that is something that we're seeing that more so than we've ever seen for years and years, and that is the growth of mental health issues. The mental health burden, the mental health issues, some of it associated with technology, by the way, the phenomenal growth of depression, anxiety, and suicide is one of the fastest growing areas that we have to deal with. Complicated. The science of mental health and the treatment of mental health is not as advanced, for example, as the science of how to deal with cardiac or other physical diseases. We're seeing an extraordinary explosion in mental health with regard to the young, and working very deliberately to try to address that. We are in New York the second largest provider of mental health in New York State, next to the major public health system in New York City. Yet it is a constant issue where the demand constantly outstretches the supply. And this raises issues around research, access to mental health services, techniques with regard to early intervention, workforce training. I don't see a diminution of this focus and this growth and acceleration in the future. I think it's probably going to get worse. And since most mental health is paid for by government, you tend to lose money almost on every mental health patient you see. So it puts enormous pressure on a health system. If you're focused on wanting to deal with the social issues that we're encountering, so it puts financial pressure. That is a great book, by the way, for anybody that wants to read it, the relationship between social media and mental health. It's a book called by Jonathan Haidt, Height. The name of the book is The Anxious Generation. Pretty scary. I would suggest people get it and peruse it. Some of it will be obvious to you, but some of the statistics there are a little bit scary. The other big issue that we're involved in a larger way is the bigger societal issues that affect health. I happen to take the view that health is broad, and we have to define it very, very, very broadly, because almost everything affects a person's health and health status. And we have, as CEOs and leaders in healthcare and leaders in other industries, have to be involved in dealing with those social issues that have a negative impact on health. I'll mention just a couple, and Mark alluded to them at the beginning. One obviously is gun violence, and guns being the leading cause of death for kids in the United States. I mean, cancer is number 3, guns are number 1. So it's very, very hard to argue that we should not be involved in this issue, since it is the number 1 leading cause of death for kids, not to count all the injuries and the mental health anguish, et cetera, et cetera. We see it on a daily basis in our facilities. So we take a broad view on this, and we're very, very actively involved and have a national coalition working on this. We also are very, very involved in the issue of sustainability, climate change, because healthcare industries and the healthcare industry itself being so large are negative contributors to the environment, and we should be concerned about this. We're also very involved, for example, on education. I happen to believe very, very strongly that if you provide a good education for the kid, you're improving their health. You provide them an opportunity for a job in a business with a sustainable income, it improves health. So we at Northwell are very, very involved in high school education. In fact, we'll be opening up our own high school of health sciences in the fall in New York City in the fall of 25, redoing the curriculum to get people connected to careers in healthcare. So there's a lot of issues on this one, but I think it's a redefinition of what we mean by health. It is way, way more than just the delivery of medical care. Couple of other items. One is the revenue reimbursement issue. And I'm not so sure how many people fully understand that in most healthcare organizations these days, and for that matter, most insurance companies, which they like to pretend doesn't exist, 60 to 70% of all your revenue comes from government. And that the government revenue is Medicare and Medicaid. And if you're definitely on Medicaid, you're definitely going to be losing money. If your bulk of your patients are Medicaid, you are in the red. Doesn't matter how smart you are, given the labor costs, especially in parts of the country like New York that we have to deal with, your revenue will never match your expense. So we have to go and find other alternative revenue streams. We have to grow the commercial business, of course, but we got to grow other revenue streams. And that's why we're involved in creating new businesses, investing in new businesses, partnering with new businesses. We have our own pharmacy business, for example, our own lab business, our own transportation business, creating as many for-profits as we possibly can inside the not-for-profit so that we can sustain the growth of government revenue. The economics of healthcare is very, very complicated. I'm not so sure a lot of people fully understand how complex it is. If you get a briefing on government reimbursement, it will be the one thing that will confuse you like nothing. Even those of us in the field for a long time get confused with it. Very, very, very complicated. And the other bigger issue that I think is important for people to understand is how healthcare is a little different as a business from other businesses. And let me just give you a couple of examples. First, and we obviously have a legal obligation on this. I don't disagree, and I think we should be doing it. But it's important to recognize that as distinct from most other businesses, we have to serve everybody. If you come, especially in hospital care, we serve all irrespective of circumstance. The right thing to do, don't get me wrong, but it puts a lot of burden on the health system. But the second thing that's important to recognize with healthcare and the way it's organized is that care is not contingent upon payment. Even if you have insurance and you come to an organization and care is provided, we have no automatic guarantee that in 100% of cases we get paid, even if the person is insured. Because payment is not guaranteed, because there are extraordinary denials by insurance companies. In many cases, about 25 to 30% of what we do on each and every day is denied for a whole set of other reasons, which I won't go into here, because the business imperatives of an insurance company is a little bit different than the business imperatives of a delivery system. And we have to spend enormous resources and time and effort to get paid, even after we deliver the service. And in many cases, we don't get the full payment at all. It may take 2 years and we'll get partial payment. And this is the ongoing continuous clash between payers and providers, which is a constant when you're running a health system like this. And the other thing to keep in mind, contrary to what some people think, we cannot set prices. And the bulk of the money we get is government money. The rest of it is negotiated. It isn't like we're running a restaurant, and if the price of labor goes up, we can increase the cost of eggs and coffee. We can't do that automatically. It all has to be negotiated. And there is some assumption out there that we can just increase prices. That is not the case. We have to negotiate all the time. So there is a uniqueness to healthcare that I think is important to appreciate, despite the fact that I believe we do fabulous work, do great work, and always have done so. The other two other points I will mention. One, at most large healthcare organizations like Northwell are very, very committed to partnerships with others. We like to partner. Big systems are partnering with one another. We're involved right now with about 6 or 7 health systems around the country, working together to see what we could do together to even create new businesses or share best practices. It happens an awful lot more than what people think. We, for example, have a huge relationship with Intermountain Healthcare in Utah, a very great organization. In fact, we have a meeting in Utah in a week or two. And I just want to mention in regard to this that during COVID, and we were one of the biggest players in COVID in the United States, as you probably know, I reached out to Intermountain to see whether or not they would be willing to send us staff during the height of COVID, and they sent us 80 employees. And my corresponding response to them was that when they would have a problem later in the summer, which they did, we sent them employees, about 80 employees from here. So we do a lot of work together with other health systems, but also very open to partner with any other business that wants to get involved in the healthcare space, but to do the right thing. So we have a lot of joint ventures, a lot of commercial activity, etc. And then the last thing I just mentioned is all of us now have to respond to what will be coming out of the new administration in Washington, because politics changes the atmosphere a little bit from time to time. There is always disruption. There's always confusion. There are always new people who come into government space. I spent a lot of time in government, so I'm very familiar with it. And so the question now will be, what do we, how do we prepare for and respond to what will be a different orientation coming out of Washington? And not all of it necessarily bad, by the way. There could be some good things coming out with some deregulation, etc. There's always, when you look at individuals or you look at general policies, there's always things you don't like at all, and there's always a kernel of truth and positivity in it. But we have to be careful, for example, and I spoke about this at a gala that Mark was at last night, that those of us that believe very firmly that we should be providing all care to all people, irrespective of circumstance, women's care being a huge issue, providing the full panoply of women's health is important, and we've got to stand by our ideology on this. That will be under pressure. We're in a better place in New York than other states, of course, and we're in contact with other states that are having a severe problem on this right now. But we have to be very committed on this. We also have to be very committed to promote trust in science. The vaccine issue, that is the big major issue promulgated by Kennedy, I think is scary, it's dangerous. And we got a lot of pressure from Kennedy supporters during the COVID crisis here not to give vaccines. Vaccines work. There is nothing, of course, that is 100% foolproof, but the science demonstrates that it works, and there is increasing vaccine hesitancy, not only in the US now, we're seeing it all the time, but overseas, unbelievably dangerous to the public health. So those of us in healthcare leadership positions will have to take public stances on these things as time goes on and not be scared of it. And not taking stances on politics as such, but taking stances on policy. And I think that is an obligation of healthcare leaders, especially those that run very large health systems, to stand up on behalf of the public and on behalf of science and discovery and doing what's right. Being in this business, it's unbelievably worthwhile. Each and every day we see extraordinary things occur. Tens of thousands of people on a daily basis, and even inside Northwell, are helped. Their lives are improved. They go home healthier than when they came in the morning or came in yesterday. We do things that were almost unimaginable, I said, years and years ago. So it's an unbelievably proud profession to be in. We should feel wonderful about it, despite the fact that we all recognize that there are unbelievable opportunities for improvement. Nothing is ever perfect. You've got to continue to push the ball and aim high all the time so that you can find things that you didn't find yesterday. I'm a big believer in a quote, I think it was by Oscar Wilde, who said that leadership is, if you define leadership, it's about, it's like, as he said, do not follow where the path may lead. Go instead where there is no path and leave a trail. And that, I think, is the obligation of all of us as citizens and as leaders in any business, is to be leaving behind something better than when we found it. And so with that, there are many, many other issues, obviously, I could be talking about, but I know time is of the essence, and I know you want to get some questions. So let me stop here and then be delighted to take some questions. And I appreciate the opportunity to spend a few moments with you. Back to you, Mark.
Thanks, Michael. So you talked about the election, but there are questions about your concerns about what's going to happen going forward post this election with some of the cabinet picks that have been made with people who don't necessarily have a medical or science background. Is that something that maybe we shouldn't be nervous about, or is that something that may be dangerous for society going forward?
I think some of it can be very, very dangerous. I mean, you have a different ideology permeating Washington these days. I mean, we don't need to go into the lowering of respectability and lowering deviance downwards, for example, which we have been seeing happening. That's dangerous from a societal point of view, I think. Some of the picks that have been chosen, yet to be confirmed, I think are very mediocre. The head of Health and Human Services was one of the biggest proponents of anti-vaccine movement during COVID. Now, there are a few things he talks about, like the reducing the processing of food and other things like that. There is a kernel of goodness in there someplace, but overall, I think it's pretty dangerous. On the other hand, he's got no experience at all in running a large organization. He's never done it. When you go into a huge bureaucracy like Health and Human Services, you can cause an awful lot of disruption. A lot of good people can leave. And the bigger issue that I worry about here is the president's comments about wanting to create a new category of employees so we can get rid of employees more easily. And that could mean tens of thousands of employees, especially those that disagree with him. When that happens, you lose experience, you lose talent, you lose history, you lose the people that actually know what's going on and how to get things done. That could be unbelievably dangerous if that's allowed to occur. His appointment of Dr. Oz recently to help Medicare and Medicaid services, I think, is also something to be concerned about. Many of us know him. He is promulgating a lot of material that I don't think stands up to science, and but again, he has no experience, no background in running a large bureaucracy. So yeah, I think it's a worrisome time, but it's not a time to put your head under the pillow. It's a time to stand up and speak publicly about that which you believe is right, and to tackle those societal and policy issues that we think will be detrimental to people's public health. A lot of people going into government now are going into government to just disrupt it, not just to fix anything. And that's disruption in itself is not necessarily bad, but you got to have the right motivation to do something good about it all. And that, I think, is a concern.
Okay, another question. As an aspiring physician and medical student, what advice would you offer for someone looking to bridge the gap between medicine and leadership roles? And this person specifically thanks you, Michael, for this insightful and engaging discussion.
Thank you. Physicians have enormous influence. By the very fact of becoming a physician, people listen. Now, when people listen, how you respond can have an unbelievable impact. So I would say for people becoming physicians, it's very, very important for them to take on and access leadership roles, or make it known to people that they want to be involved in some leadership capacity. Doesn't have to be the head of a department, can be head of a unit, a small division, and get engaged, begin to understand the politics of your organization, the economics of your organization, the social issues that your organization has to deal with. They make themselves heard and known to others. without strong physician leadership, above and beyond just the clinical knowledge that they have, if you don't have strong clinical leadership, you cannot have a great healthcare system. They are key, and we have major training programs at Northwell for physicians who want to leadership positions. We pick about 70 to 100 people a year and put them through 2 years of a training program, giving them exposure to lots of things that they normally in medical school wouldn't get exposure to, so that they can become much more attuned to what they need to get involved in. So good healthcare systems, and most of them are around the country, there's so many good ones, are very welcoming of physicians who want to learn. Not physicians who come in saying, but because I'm a physician, I know it all, but to come in and say, I'm a physician, I know a lot, but there's a lot more that I need to learn, so I need you to help me, and let's work in partnership to do so. And so I would say for the person who asked the question, make yourself known, connect with the leadership of the organization, get involved, and when you do so, you will be surprised about the positive impact that you can have.
Okay, and next, can you talk about the potential merger of Nuvance and what made Northwell select this health system?
Well, part of our overall strategy for years has been growth, continuing to grow. We start in the middle and we continue to grow outwards. It's like growing the onion all the time. And Novance is an organization that is really close to us, an organization that's a result of 2 previous mergers. I entered into a relationship with a component of this organization about 8 years ago, because when we look at expansion, that is the next area for expansion for us, and we're in the expansive. We have an expansive philosophy. A good organization, 7 hospitals, about 100 ambulatory sites, about 15,000 employees. 2 systems that came together right before COVID, and COVID, of course, disrupted the integration. We think that this will be wonderful for us to broaden our catchment area, broaden our influence, and that it needs some work. Like all organizations, most organizations have some issues that need to be fixed. Novance does, and this all should happen, and we should get all final approvals by January of next year. The only approval left today is the Connecticut Department of Health. We had down here yesterday about 30 of their leaders with us all day. We've had numerous discussions. It's a good culture, a good positive feel all around. So we're looking forward to the opportunity to be able to actually start working directly with them so we can do things together. Up to this point, we couldn't because we didn't have all of the regulatory approvals. This, I think, will make us better, will improve the healthcare in those communities, and I think it's going to be a win-win all around. We're looking forward to it.
Somebody asks, with the advances of medicine allowing care to take place in the outpatient setting, what will hospitals look like in the future?
Hospitals will be very busy because of a couple of things. First of all, though, most people in hospitals will be older, more chronic illness. Typical tertiary campus will be an ICU, intensive care unit, as well as delivering babies, because most of the easy stuff will be outside, will be taken out. So hospitals will become busy because they're more busy in many ways because there is a growth in the aging population. Hospitals are not going to disappear. Interesting fact with us, by the way, since we were one of the first to dramatically in this area increase outpatient care, and we now have 900 sites. But as we increase outpatient care and you increase access to communities that were previously underserved, you identify an awful lot more people that need inpatient and serious and chronic care. If you go in, and this is the fallacy that a lot of people, have, they want you to expand access, serve everybody, go into poorer communities, and then have less hospital care. The opposite is going to happen, because when you go into an underserved community, you're going to find people that have been undiagnosed. If you're going to do it right, you're going to assess that they need, for example, many would need, for example, cardiac care, other tertiary businesses. So that will feed the hospitals, and that's been the case in our situation. The more we've expanded ambulatory, the busier our hospitals have gotten. Even though the bulk of our care is not in the hospitals anymore, but the hospitals are busier and busier. It's a kind of a reverse reaction that people don't fully understand. You also, when you grow ambulatory, you gain market share, and you identify more people that need more inpatient care. But the demographics are going to be a big part of it. And obviously, that can be ameliorated over time with the use of technology. Obviously, it can be ameliorated greatly over time, over long periods of time with prevention and going upstream. But hospitals will still be strong. There are few of them, like in the New York area, there are 30 fewer hospitals today than there were 30 years ago in New York. But the hospitals that are now remaining, my guess is the vast bulk of them will continue and be strong.
Okay, and we're running out of time, so I'm going to ask, pick one final question. What is your opinion, Michael, about the non-traditional players such as Amazon's One Medical, Google, whomever else might be entering the healthcare arena?
I welcome them. I mean, we work with One Medical, we work with Google, we work with Amazon. There are always good ideas that come from every place. So I think it would be very, very foolish to make the suggestion that they should not engage in coming up with solutions that could potentially help everybody. We all learn from it. My issue with some of them is that they claim that when they come in with a nice new app or some small piece of technology, that they will make claims that they're going to solve the healthcare problem. No, they're not, because they're not touching the real serious parts of the healthcare problem. They make a contribution. They help on the fringe. It can be useful. And so we should welcome it, but fully understand that they're not the magic bullet that's going to solve the serious issues that we deal with every day, because quite frankly, they stay away from it. One Medical, which I'm very, very familiar with, I know the guy that founded it. We've had numerous discussions with One Medical, but they're a kind of a niche player, and we've been trying to do a relationship with them. We may end up doing one. They're a niche player, do some nice work, but again, they stay on the side. The more that get involved with good ideas, the better. We should be open, we should be welcoming, we should learn. But my suggestion to them is, please don't go to the press and claim that because you got something small in a little corner of some place that you're solving the problem for everybody else and you're solving the serious issues. You're not. None of them, by the way, have come across to say, by the way, we'd like to take over a hospital. We would like to take over a mental health hospital. We would like to focus on serious chronic illness. Or we would like to do transplant. No, they don't go near those kinds of things. But other than that, we welcome all players to the table. We all win and we all benefit when good people try to do good things together.
Michael, thank you. Thank you for your time.
The pleasure.
As I knew ahead of time, listening to you is always a pleasure, and it was very informative, as that one questioner said, informative and engaging, and we appreciate the time you took. And for those on the webinar itself, thank you for joining. This has been taped, so if any of your colleagues or anyone else you know would like to hear it, please get in touch with Janine Kratiger, and we will get the tape out to you. So with that, we'll close the webinar.
Thank you so much. I appreciate the opportunity. Thank you, guys.